information here, right? Yeah. So, my name is Dr. Kewas. I am the dermatologist here. It's very nice to meet you. And today, what I'm gonna do is that I will be assessing your skin. Yes. Like the overall health, looking at the problems and issues you have. Yeah. So, first of all, I'm going to ask you some questions, such as your name and your last name. Perfect. Can you spell it out for me? Yep. I wasn't really sure. Good. Perfect. So, I'm going to ask you some questions regarding your skin. So, is there anything you'd like to tell me before we start? Like any particular issue that you noticed? Okay. Yeah, I can see. And something that I can really see it obviously. Okay. Perfect. So, great. Do you use any products? Do you wear makeup at the moment? I can't really tell. No, that's great. Yeah, also I can see that you're wearing no necklace, no earrings. That's perfect. Can I ask you, did you read our website where I actually give like instructions what to do when you go to see dermatologist, like wearing a makeup, or is that like a regular state for you? Yeah, good. Yeah, I like when patients come prepared. That's it. Good. So do you wear makeup often? Well, actually, I do not really recommend it because it really doesn't let your skin to breathe, and the pores just get clogged easily. And most actually people do not really cleanse the skin properly. They just kind of scrub it off really fast, and then there is a lot of residue, and the skin actually ages much faster. Yeah, so good. That's for all the answers. Perfect. Maybe I will add some questions during the procedure. I hope that's alright with you. So at first I'm going to assess your skin. I'm going to have to look really closely. Hopefully it won't be unpleasant. So what I'm gonna do now, I'm going to take these gloves. Great. Now I'm going to look at your skin really up close. Hope that is alright with you. Okay, so may I? Perfect. So let's start. I'm going to divide your face into several parts. So let's look at the first part, and that's your forehead. Okay, so I can see there is some redness, kind of a lot of blackheads. Yeah, like your face is kind of clogged. Okay. So now let's look at the other. It's pretty much the same here. It's kind of dry. Well, do you think you have like what kind of skin type you think you have? Okay, so you think you have an oily and problematic skin. Okay, why? You read that on the internet. Yeah. That happens quite often. Why do you think you have oily skin? Because you have acne. Well, that's not really how it works, but we'll get into this. Okay, so pretty much you have kind of a dry skin, especially on the forehead. It will need to be moisturized. I recommend drinking a lot of water. Then the hydration of the skin kind of does it itself, So Now let me look at your nose. Okay, there is some dead skin, big pores on the nose, especially on the sides. Yeah, let me look at your nostrils. Your nostrils. Good. Okay, so it's pretty much red in this area. Okay, there's a lot of big pores and a lot of blackheads. As I can see, we are getting to the side of your face, so basically your cheeks, and I can see you have a lot of acne. Alright, I can tell you right now that a lot of these problems are actually caused by your mobile phone and you actually touching your face. You know, your hands get really dirty during the day, especially when you're touching your phone, because you basically put the phone everywhere, right? Yeah, that's what I thought. Okay, that's what I thought. So this area is full of acne. Well, and when you actually touch with the dirty hands your face, it actually kind of gets into the skin. You know, like skin is the biggest organ we have on our body. Yeah, definitely it takes up to 70% of our body, and it actually kind of sinks in the things you actually put on it. Yeah, even the bacteria and so on. So that's maybe why you have the acne in this area. Okay, and also I want to say one thing. It also can be caused not just bad hygiene, but also by the fact that you are sleeping on a dirty pillowcase. Try to wash it like at least once a week. Yeah, I really recommend that. And also before you go to sleep, just wash your face. It's best to use actually oils. Yeah, I'm not going to recommend you today. Okay, so now your upper lip area and under your chin. Okay, so this part is hormonal. So when there is an acne, which you have there, as you probably already know, it can be caused by the like hormonal disbalance. So I would actually recommend you to try to eat more healthy. Yeah, good. So this is your face. Now let me look at your ears. Your ears. Good. Okay. Again, there is some dead skin and dry. You will have to moisturize it more often. And it's the same here. There is a little rash. Okay. Now let me look at your neck. Do you have atopic eczema? Are you aware of that? You never heard of it before, okay? Okay, because I can see you have a little rash. Is your skin here itching sometimes? Okay. Yeah. Alright. I actually think it's atopic eczema, so we don't know why it actually bursts out. Yeah, but I can recommend you some products. There's not going to be a lot of them, I promise, and they are not based on chemicals. Yeah, because I simply don't care about these products. Okay, now let me look at your face properly. Okay, I'm going to shine a light a bit under your nose. Okay, to look into the nostrils. Good. Yeah. Okay. Yeah. Okay. dirty particles that you have there, alright? So, your nose from the side, your chin. Brush your eyebrows, brush your nose, your chin, around your lips, and now your ears, good, one side and the other side, and now your neck. That's perfect. You're looking just fine. That's great. I'm going to write down some notes. So this area is clogged. Big pores, acne, and pimples. Yeah, pretty much everyone says, right, when you're young that it's kind of normal to have acne and that it will go away, but sometimes it simply doesn't, and it's completely normal. I myself actually struggled with terrible acne when I was younger, but I did some precautions, and I also went to dermatologists. They used a lot of chemical products. Unfortunately, they were not really successful, and I started to use like herbal and all natural cosmetics, and it really helped me out. Yeah, there was nothing that would actually dry, because they will give you the chemicals that will dry basically the pimple out, right? But when you're like drying the skin, there is need to be produced more of the fluid that actually creates the pimples, so it doesn't really make sense. So what you need to do actually is to moisturize your skin. Yeah, I know it sounds weird, but it's really how it is. To rid of the fluid, you have to add up the fluid. So yeah. Good. So I have everything written down. Perfect. Now I'm going to teach you a technique. Okay, there's a technique. You will actually like take a towel. You will take a towel that is soaked up with the hot water, really hot water, and then you will just get rid of the water. Okay, then you will press it on your face for about 15 to 20 seconds, and it will actually like open up the pores, and it will be much easier to get into the skin to really clean it properly. Yeah, then you will take an oil that is suitable for your skin type. I can see you have a sensitive skin. Because there is a lot of redness. Especially in the forehead area, and then around your lips, chin, and a little bit of around your nose and your cheek area. Okay, so you will take the oil and you will massage it. You will rub it into your. You will rub it. Yes, just like that, into your skin. Good. You will rub it into your nose, also your cheeks. And please do not forget about the area under your jaw. Yeah, exactly like that. And also the neck. And your default chest, basically. Yeah, that's good. Perfect. And now that you have this, and you can actually even apply the oil on your eyes to get rid of the mascara and also some other eyeliners and this stuff, basically. And then you will take again the hot towel that is again without the water, and you will kind of scrub it up with the towel, okay? Yeah, like this. Okay, so now that we've cleansed your skin, I actually can finally touch you with my bare hands. Okay, so I'm going to get rid of a few pimples here and there. Basically, mostly like the blackheads that you have. Okay, so let me start with your cheek. So let me just press it, and yeah, and I'm just going to scrub it on. Okay, and there we have it. Can you see it? It's your black hat. Okay, so now let me look at the other side. Let me just press, and there it is. It bursted out, and let me just look at it, and there we go. Another like really excessively big black hat. I must tell you that I honestly haven't seen a person with such a condition with the skin for a while now. Yeah, but if you really listen to my advices, you will be like really fast to get rid of it. Okay, so now let me just press and push the pimple out, and there we go. Another one is really huge. Yeah. Okay, now let me just get rid of it. Yep. So we'll continue like that for a while. Around your nose area, not around your nose area. We'll actually kind of press a bit more spaces. Okay, and now let me grab the tool of mine and just scrub it over everything, and it looks just really disgusting. I'm sorry to say that. It's really disgusting. I don't mind, it's my job, you know. I'm actually kind of, I don't know, amazed by these things. Yeah. So let's look at it. Yeah. So this is basically it for now. I hope that the overall advices helped you a lot, and let me look at your skin now, like that, and it's much better. It's red for now, but it will calm down in a second. It will calm down in a second or two. Good. Yeah, that's perfect. So, do you have any additional questions? No, so you understand everything pretty much perfectly. Okay, that's great. I'm actually really glad. So, these were my real advices, like my real advices that I would give you. If you would like to know something more about the cosmetics that I recommend to use, I will leave the link down below or in your email if you want to. Okay, that's perfect. Yeah. So it was really a pleasure. It was really a pleasure to meet you, and hopefully we will see another time and your skin will be much better. If you will have an additional question, you can actually set up again an appointment with me and we will discuss everything. Okay, so this is it. Thank you very much and have a wonderful day. Bye. Yeah. Who is the other patient, please? Okay, great. So send Mr. Johnson in and we can actually, yeah, start with the examination. Perfect. Thank you, Amanda.